Well, we're still in the midst of a global pandemic, and we're working our way through it. We've said here before, there's no book that we can write that has all the answers. And we have been working through this, trying to make the best decisions we can, and certainly trying to use a reasonable approach as we go. But I think P.E.I. together, we have done some things well. And we really did come together by staying apart. It has been 45 days since our last case of COVID-19, and it's been 34 days since all our cases are recovered in P.E.I. We've not had any hospitalizations, no deaths, no outbreaks, and this is really something that we should all be pleased about. We are continuing to do testing. We have 330 more negative tests since Tuesday. We've done more than 8,200 tests. So I think these are all good things as we start this briefing today. As we continue through phase 3, we know there's a lot of interest in what the next phase 4 will entail and when it will begin. Phase 4 will begin on Friday, June the 26th. And while there are still pieces of this phase being determined, there are some parts I think might be nice for people to know about today. We are working on more opportunities for visits at long-term care facilities, and some of these will be able to be indoors. And I know there are meetings about this happening even today. There will be an increase to team and organized sports for up to 50 people. There will be increased personal services for things like facials and electrolysis, and small festivals and events of up to 50 people will be permitted. VLTs and casinos will also open. It's important to note that the change to 50 is for organized events, churches, funerals, and weddings, but the personal gatherings of 15 indoor and 20 outdoor will not change. And we continue to assess the gathering limits for all organizations and activities on a regular basis. And on that note, we are an invitation is going out today, if it hasn't already, to a large number of faith leaders across the province to discuss faith-based gatherings and the numbers and situation as we go into this new phase. So looking forward to that conversation very soon. And it's easy to get caught up in the numbers, but I think it's important that we don't forget the basics. With any gathering of any size, we should be practicing that physical distancing, washing hands, not attending if you are sick, and these are really important. And the intent behind all of it is to keep gatherings small, because if there was a case of COVID-19 within a gathering, it can spread quickly. And we've learned that, we've seen that all over the country and around the world. And with larger groups, it is more difficult to do contact tracing, and in turn, more difficult to contain the virus. I've spoken different times here about the desire to bring families together, and also about the potential for a bubble for the Atlantic provinces. As Premier King indicated yesterday, the Atlantic premiers are committed to working toward a bubble to provide safe and efficient travel throughout the region, and this would be done without a need to self-isolate. And I know based on their conversation, and they're also looking at the epidemiology of what will happen in the next few weeks, but this could happen as early as the first week of July. And this would make it even more important that the basics still continue. That physical distancing, the hand hygiene, not going out when we're sick, the enhanced cleaning, and keeping separate if someone staying in your home is in self-isolation. And this would continue to mean, though, that those traveling from provinces outside of Atlantic region would still need to self-isolate at this time. And we have been asked about families who we recognize the need to connect and that importance to be connected. And so some of that will be addressed in the Atlantic bubble. For many of us, we have connections and families in other provinces in the country. And for those who have family outside of Atlantic Canada, we are in the process of finalizing this process with ITSS, Public Safety Office, and our office, so that families can apply to be together, and that they will, though, have to self-isolate when they come from outside of the Atlantic Canada as we go forward. As we head into another weekend, I want to encourage Islanders to be safe. I listened to Dr. Peter Lynn on media this morning talking about the experience of New Zealand and the success they've had. And as I listened, we have been compared in some ways at different points to New Zealand. And when he gave his summary, I thought, really, we did a lot of the same things here. We closed down quickly and early. We put restrictions in at our borders very quickly. We've talked about how important it is to self-isolate when people come from other places. We've managed some of the risk, and we've communicated ongoing to the public. When I hear that, it makes me think that we will also get to go forward and continue to make some good decisions and look to New Zealand as an example. So we are extremely fortunate here in P.E.I. And really, in the last few weeks, we are gathering in small groups. We're visiting more at long-term care. We're able to eat out at a restaurant and have access to personal services. But it is important we do not take this lightly. So we don't want to forget the basics. Let's think about others and how we protect others. And let's be patient. Let's be kind. Thank you. Je vais peut-être dire quelques mots en français aujourd'hui. Bonjour. Je commence par dire que c'est 45 jours depuis qu'on a un cas ici à l'île du Prince-Édouard de COVID-19. Et c'est 34 jours depuis que tous les cas sont recouverts. Alors, c'est une bonne chose. Je pense qu'on a fait des décisions par tout le monde. Et on commence de voir le succès après tellement de jours sans un cas. Et on est là à la phase 3, mais il y a beaucoup d'intérêt pour la phase 4 et ses détails. Ça va commencer le 26 juin. Et quelques informations que je peux partager aujourd'hui. Il y aura plus de visites au foyer et puis on est en train de discuter les détails. Au foyer de soins de longue durée, même à l'intérieur. Il y aura plus de personnes permis pour les sports, aussi les églises, au maximum de 50 personnes. Les casinos et les machines de loterie seront ouverts. Plus de services de beauté, comme l'électrolyse, sera disponible. Et les petits festivals et événements seront permis avec un maximum de 50 personnes. Le changement pour les rassemblements et pour les événements organisés comme les funérailles, les noces, l'église, c'est vraiment à 50, mais les maximums pour les rassemblements personnels vont être 15 à l'intérieur et 20 dehors. Et encore, ça commence le 26 juin. Mon bureau est en train de travailler toujours sur les chiffres pour les rassemblements, pour les événements organisés. Et on est en train d'inviter, si ce n'est pas déjà fait, les leaders religieux pour discuter de la nouvelle phase et qu'est-ce que ça veut dire à propos des numéros. Et les chiffres sont importants, mais les pratiques, mais il faut qu'on n'oublie pas les apprises et adopter sont encore plus importants. Peu importe la grandeur du groupe, pratiquer la distance physique, la bonne hygiène et rester chez vous quand vous êtes malade, ça n'a pas changé. C'est difficile de faire les suivis avec les grands groupes et encore plus difficile de confiner la transmission. Et on continue de parler souvent de bulles atlantiques et des réunions de famille. Et hier, le premier ministre a discuté avec ses homologues atlantiques le désir d'établir une bulle qui va permettre des voyages dans la région qui seront prudents et que les voyageurs n'auront pas besoin de s'isoler. Et c'est prévu pour le début juillet. Et on travaille à réunir les familles de la région et ça fait partie de la discussion de bulles depuis le début. Mais pour les familles dehors de la région atlantique, on est en train de finaliser un processus pour faire une application. Les familles qui vont rejoindre ici doivent auto-isoler pendant 14 jours quand ils arrivent, s'ils viennent dehors de la région atlantique, quand ça vient. On s'approche du week-end, donc restez vigilants. On est très chanceux ici comparé aux autres. On peut se réunir en groupe, voir des proches au foyer, sortir au resto. Il ne faut pas prendre ceci pour acquis. On ne veut pas reculer à des mesures plus sévères. N'oublions pas ce que nous avons appris et souvenons-nous que pas tout le monde est confortable avec la situation actuelle. Et soyez patients, soyez gentils et prenez soin de l'un de l'autre. Merci. I'll turn over to you, Marion.
Good morning, everyone. More services continue to open across Health P.E.I. under the guidance of the Services Reinstatement Team. To date, services have reopened at some level within primary care, our surgical services, endoscopy, and ambulatory care services at the Prince County and Queen Elizabeth hospitals, laboratory services across our facilities, diagnostic imaging services including breast screening, obstetrics and gynecology clinics, and community mental health and addictions. Other services are planning for an easing back into more non-essential services. Our surgical teams in other areas that had to postpone appointments and procedures, such as diagnostic imaging, are working hard to recover those services while balancing the need to maintain capacity to respond to future cases of COVID-19. This is all being done while adhering to physical distancing measures and using appropriate personal protective equipment. One of the areas I spoke about reopening more services is in primary care, which is an area where a large number of Islanders receive care. As with all services, there are changes on how they will be delivering care during the pandemic, and appointments with your doctor and nurse practitioner may look a little different. Patients are asked to call ahead to book an appointment, and your call to the clinic will determine the type of appointment you require. It may be a telephone appointment, an in-person appointment, or a video call, if you have the required technology available to you. If your physician or nurse practitioner visit is by phone or video, you'll be given a time to expect the call or emailed an appointment with instructions for the video. If you do require an in-person clinic visit, you'll be asked some screening questions when the appointment is booked, and we ask that you don't arrive early for your booked appointments, as these are being carefully scheduled to maintain our physical distancing and space. Entry to the clinics will be limited to the person who has the appointment and a support person if necessary. When you arrive at the clinic, you'll be again asked the same screening questions. You'll need to do hand hygiene, and you may be asked to wear a mask when you arrive. Physical distancing measures are in place at our clinics with waiting rooms and chairs that are spaced 6 feet apart, and you will be escorted to the exam room as soon as possible. As I mentioned last week, services are now also allowing support people to accompany patients for appointments and procedures. And we just wanted to make it clear that the ability of the support person to stay with the patient depends on the ability to physically distance within some of our service areas. Due to the varying space constraints, these rules do vary from unit to unit and service to service. For example, a support person may be able to accompany someone into a waiting room, but not into a procedure or treatment room if space does not allow. If you have a support person with you for an appointment, we ask that you do call ahead to the clinic the day before, and the protocols in place for that service will be explained to you. We thank you for your patience as we work through this and adjust to new processes. We appreciate your patience and kindness as we put these processes in place to keep everyone safe. Thank you.
Thank you, Marion. And open it up for questions.
Laurent Rigaud, La Voix acadienne.
Bonjour, docteur Morrison. J'ai une question juste en français de précision parce que j'ai pas compris ce point-là. Sur les rassemblements qui seront permis lors de la phase 4, est-ce que vous pouvez réexpliquer en français si on va pouvoir donc avoir des rassemblements jusqu'à 50 personnes et pour les noces ou les funérailles ou des événements spéciaux, ça pourra aller être un chiffre plus élevé, c'est bien ça?
Bonjour. Alors, les rassemblements phase 4 sont jusqu'à le chiffre de 50. Et c'est pour l'église, les funérailles, pour les mariages. Mais je sais qu'il y en a des églises pour qui veulent même un plus grand nombre. Et puis, on est en train de discuter avec les leaders pour les églises et pour les religieux, les rassemblements religieux. Pour qu'on peut-être bien comprendre ce qu'ils veulent. Et pour certaines églises, c'est le numéro 50. C'est bon, ils sont contents, mais il y en a d'autres qui en veulent plus. Alors, je pense que c'est une discussion importante d'avoir. Mais pour le moment, c'est tout à 50, mais c'est pour les rassemblements religieux qu'on est en train d'avoir une discussion.
OK. Et j'avais également une question sur la possibilité dans la phase 4 pour les membres de famille qui habitent hors des provinces atlantiques de venir. Vous avez dit qu'il y aura des dispositions qui vont permettre à ces gens de revenir à l'île s'ils s'isolent 14 jours et de revenir dans leur famille. Est-ce que vous avez une idée du nombre de personnes qui sont concernées par cette mesure?
On n'est pas certain le nombre. On sait qu'il y en a beaucoup aux régions atlantiques. Alors, si on a à la boule région atlantique, ça va permettre beaucoup de familles dans cette région. Hors de la région, c'est difficile de savoir pour certains. On sait que il y en a assez grand nombre de résidents saisonniers qui ont aussi des familles ici. Alors, on a plusieurs de cette façon et c'est difficile de savoir pour certaines le nombre d'autres familles qui vont essayer de venir. Et puis, même s'ils s'auto-isolent, isolés pendant 14 jours, on n'est pas certaine, mais on sait quand même que c'est important, cette connexion entre les familles pour voir leurs enfants, pour leurs enfants de voir leurs parents aussi, et les petits-enfants, c'est important. Mais on doit faire prudemment avec et s'isoler s'il vient d'autre part.
Merci.
I was asked just to try to make sure that I translate my responses. So the first question was about trying to just reconfirm that the number of 50 in phase 4 would apply to churches, weddings, funerals, and that is the case. The discussion with faith leaders is really around that mass gathering number, recognizing that a number of the very large faith gathering places feel that they can accommodate more. So like everything else, we'll certainly have that conversation and look forward to having that important discussion. And that just again reconfirming what we had talked about in terms of the importance of family connection, and if do we have an exact number of how many families want to reconnect with Islanders? We don't know for sure. We know that a large number of those are in Atlantic Canada, so if there's an Atlantic bubble, that will certainly mean quite a few families get to reconnect from this area. We know that some of our seasonal residents also have the family connection here, so that that number is included, or I guess we think of those as family reconnections as well. And then the numbers of family outside the Atlantic region, hard to know for sure, but we think it's important that children get to see their parents and or elderly parents, and for parents to see their children or grandchildren and provide those supports. So those have been things that we've talked about here before, and we continue to think they're important, and we'll manage the numbers as they come.
François Carpifo, Radio-Canada.
Good afternoon. Une question pour vous en français, Dr. Morrison. Avec ce projet de bulle de déconfinement en Atlantique, qu'est-ce que ça voudrait dire pour les contrôles qu'on a ici au pont de la Confédération, éventuellement au traversier de Wood Island? Est-ce que ces points de contrôle-là demeureraient en place? Quel genre de forme ça prendrait, tout ça?
Bonjour. Les contrôles demeurent en place aux entrées à l'île du Prince-Édouard, alors au traversier et au pont. Ça va continuer. Et on veut que les personnes ne sont pas malades, et puis qui viennent de la région, au moins de la région atlantique ou ailleurs. Alors, ça va continuer. Cette partie ne va pas changer.
Et puis, la quatrième phase qui va commencer le 26 juin, avez-vous une idée de combien de temps elle va durer avant qu'on revienne à peut-être quelque chose d'un peu plus normal au niveau des déplacements ou du nombre de personnes qui peuvent être dans un endroit en même temps?
Oh, c'est une bonne question. Alors, je ne sais pas. Pour certains, on va continuer à regarder qu'est-ce qui arrive au Canada, qu'est-ce qui arrive partout au monde, qu'est-ce qui arrive ici à l'île du Prince-Édouard. On est en train de regarder, discuter, parce qu'on pense aux écoles en septembre, on pense, on essaie de faire les plans dans les mois qui suivent, sauf qu'on ne sait pas tout à fait qu'est-ce qui va arriver dans les prochaines 2 mois, mais alors j'ai pas une date, mais j'aimerais en avoir, mais je n'ai pas à ce moment.
Merci beaucoup.
Okay. One of the questions, which was a good question, would even with the Atlantic bubble, would there still be controls at the bridge and the ferry, and that will continue. There'll continue at this point to be those border measures or border checks in place. And the next question was about when I expect that there would be a complete return to normal, and I said I don't have a date for that. I wish I did, and it'll depend on what's going on around the world, in the country, here in Prince Edward Island. Certainly it may even depend on vaccine, and we've talked about that before. But at the same time, we're trying to plan and look ahead a number of months and what's going to happen in schools, what's going to happen in the fall. So it's hard to predict for sure, and I wish I had a date to say when we all go back to the way we were living at Christmas time, but I don't have that.
Louise Martin, CPC.
Oh, hi. Good afternoon to you both. I'm actually wondering about, I know that there's no final details of an Atlantic bubble, but I'm wondering if you had given any thought to seasonal residents from outside the Atlantic region, and whether once they're here and approved that they would be allowed, and they've already done their self-isolation, would they be allowed to enjoy travel between the Atlantic provinces, or would you be requiring sort of identification that you are a resident of Atlantic Canada?
Louise, that's a great question. I actually brought that up with my Atlantic counterparts yesterday, that exact thing. So, how is that going to work between all of the Atlantic provinces? And we didn't have an answer that had been worked out, but we raised it as an issue that we will need to think about and consider in the next few weeks.
Thank you so much. And my other question is about essential workers. With the summer nearing, there will likely be more essential workers coming here from off-island for projects, construction, that kind of thing. Are you considering allowing them to be tested instead of self-isolating when not working, the same as P.E.I. essential workers?
So yeah, that's come up. I mean, at this point in time, we've been really doing the testing for essential workers who live on P.E.I. who cannot get out of self-isolation, and really that has been the purpose, because there were some essential workers who were perpetually on self-isolation, which had huge impacts on their family and of course on themselves. We have to remember that testing doesn't replace the importance of self-isolation because of the sensitivity of the test, and so we're always looking at who we can test and how we can keep people safe, but so it's something we can look at, but we haven't to date. The other thing is that of the essential workers we've tested a large number of essential workers that have been coming in and out, and they have been all negative because we've been testing and we've been testing asymptomatic people. So if they're coming in and out as essential workers from the Atlantic Canadian area where we don't have high numbers, we need to also look at the value of that of the tests at that time.
What if they were traveling from outside the Atlantic region, though, say from the so-called hot spots in Canada, Ontario, and Quebec?
I mean, I think those even more important that they self-isolate, and we may need to look at those, and that's actually what we were doing initially with what we are doing with our truck drivers, really focusing on those Ontario, Quebec, and international truck drivers. So recognizing that the number is, as you mentioned, quite high. So we'll continue to explore that as we deal with a number of different groups, consideration for testing, and trying to balance that capacity for testing, but also how important where those hotspots are. As you said, for instance, we have done testing of some essential workers going into large plants. Here in Prince Edward Island, we've done testing of our temporary foreign workers. So we are certainly doing some of that testing of essential workers anyway.
Thank you. Have a good afternoon.
Jessica Doria-Brown, CBC.
Hi, this is a question for Dr. Morrison. What types of measures are being discussed right now at long-term care homes as we look forward to phase 4? What would be the natural next step there?
Hi, Jessica. I know they're having conversations, and and Marion may be able to speak to this as well, but as we said when we talked about long-term care visitation restrictions and limited visitation to start with, that it was going to be a phased approach, and starting with a lot of outside visits. And I think as they are talking about next phases, does the number of people who can see someone outside increase? There's certain designated people that can go visit inside. What precautions need to be taken to make sure that everyone is kept safe? And knowing that some of that discussion was even happening this morning, I think we'll hear more details about that in the days ahead. And I think it's really important to make sure that our facilities are comfortable as well with some of these lifting or easing up of visitor restrictions, because we know that these facilities, whether community care, community residential facilities, long-term care, are just such a critical group, and that we all have a role in protecting. So understanding how important it is to see family in long-term care, for instance, but trying to balance that again with being careful. So I think there'll be more details that are worked out in the days ahead.
And I'll just ask if Marion Dowling has anything to add to that before I ask my second question.
Hi, no, I think Dr. Morrison's covered everything. We've been talking about other parts of the residents' lives that live within our home, and other services and things that are important to them, like getting their hair cut and those other things. So what are the other pieces of their livelihood that we also have to consider as we look ahead and making plans, and really look to shift, like we have in all our other services, to try and maintain physical distancing if that's possible, put other parameters in place, looking at the residents' dining rooms and how they have adjusted those so far. Can that change? So there are many things to be considered in how the residents live within those homes, that we really just need to look at the whole picture and what's best for them.
Okay, thanks. And my second question is for you, Dr. Morrison. When we talk about travel around the Maritimes or the Atlantic provinces, what sorts of measures can you tell us now would likely be in place to ensure continued safety and to keep the possibility of cases as low as possible? Essentially, what might this travel look like for people traveling to and from P.E.I.?
So I think we talk about the basics and how important they are. We've been stressing them right throughout, and I think as we open up, whether it's opening up in terms of our numbers and gatherings, the activities we do, or our borders, we shouldn't travel if we are ill. We don't want to expose other people. We need to maintain physical distancing where we can. The enhanced cleaning that we talk about, hand washing, they are going to be really important. And Now, it's also important that if you have symptoms, wherever you are in Atlantic Canada, that testing is available, and you should be tested. And so early identification of the cases is, I know, important for all the provinces. And then the contact tracing around it. So in terms of course, we worry about the larger number of people that with an Atlantic bubble, but we recognize that that's also an important step in our path forward. And so really trying to be careful, trying to make sure that what we do not only protects ourselves, but we're thinking about others and not wanting to expose others to the potential of a virus or the spread of COVID-19. So I think it's reinforcing some of the messages we've talked about, reinforcing the measures that we have in place within each of our Atlantic provinces, and trying to remind ourselves all the time why we're doing this, and that we're in a pandemic and a public health state of emergency for all the provinces that in Atlantic Canada that we really need to pay attention to.
And sorry, I'll just think one more thing on that. Would it be that, say, people traveling to the island would have to answer questions on a questionnaire, or I'm thinking along the lines of what I have to answer at daycare every morning. Would that kind of thing maybe be in place, like coming from the province?
Well, I mean, we mentioned, I guess, earlier in French that the controls would be at the bridge and that screening happens at the bridge. Anyway, if you're having symptoms, then people are directed for testing. So that will certainly continue on the P.E.I. side of the bridge. And a lot of places people go in terms of going into facilities are having to make sure that people aren't sick, and I know it would continue for long-term care as well. So again, I started today by saying that there's not a book that we can pull from the shelf exactly to say all the things that we need to do as we go forward, but we'll be certainly looking at how we can keep our islanders safe. We've been working all together to try to do that. We've looked after each other, and we need to continue to look after each other as islanders and as Atlantic Canadians.
Okay, thank you very much.
Jim Day, The Guardian.
Good afternoon to the both of you. Dr. Morrison, with phase 4 just around the corner now, could you talk a little bit about the level of pressure you experienced to further ease the restrictions to allow the province's economy to open up more?
Hi, Jim. So it's a good question. I think that there have been pressures all the way along. Pressures about closing and pressures about opening up, and at various stages and by various groups, and it's been a range. I think in the end, every day, and we've said this certainly with our team, that we are thinking every day about, despite all the pressures, and that we're trying to make the best decision we can for the protection of islanders, recognizing that there are other factors in that are really important too, recognizing that families, being together, economy, what activities we do, all impact our health as well. But trying to guide us through this pandemic with the protection of islanders and the health and safety of islanders as what guides us every day. So Yes, there have been pressures, but we think about what we need to do all day, every day. It consumes us all on our team, and so I don't think the pressures on one particular day are that different than another one. But all trying to look at our epidemiology here. What is the best evidence that we have in a virus that we've still learned a lot and continue to learn a lot about, and making sure that we're here talking about the changes as we make them, the new advice as we get it from the rest of the country and around the world. So sort of long-winded answer to that question, Jim, but it's probably not an easy question to answer.
Right. How much, if any, of that pressure are you feeling directly from the Premier, who said Wednesday that we feel as an Atlantic Province group that our economy needs to continue to move forward? The health of our economy is just as important as our other health matters.
I'm not. I mean, I think we've talked about an Atlantic bubble, or initially it was a New Brunswick P.E.I. bubble for a long time. So I don't think it's particularly new. It's something that we all have been discussing and aware of. I think it's something that we enter cautiously. And we haven't done so yet, but assuming all goes well in all our provinces, it's something we'll enter cautiously. And I know the premiers are certainly wanting to do this as well, but they also want to be careful and appreciating that it could be fragile if something changes. But it is something that we'll continue to look at. We've talked about before. I've worked, we've worked very closely with the Premier on this, and as he's worked with his counterparts in Atlantic Canada, I've been in discussion with my counterparts, and we're all taking these steps together.
Thank you.
Okay, thank you very much.